For Data Lab Challenge 3, we got the project to determine the coronavirus outbreak peak in number of cases in the USA. We proposed to use maximum likelihood estimation combined with polynomial regression to accurate the prediction. Also, we will look at the maximum capacity of the healthcare system to check whether more hospitals will be needed to meet the peak or not. We have divided the whole project into 4 sections. In section 1, we will be discussing a little bit about the COVID 19. There will be some statistical data analysis on section 2. In section 3, we will show some COVID 19 modeling and at last the prevention and conclusion. COVID 19 is caused by a coronavirus called SARS CoV 2. It is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. Infected people have had a wide range of symptoms from mild symptoms to severe illness. They may have cough or breathing problem with fever, muscle pain or headache. But the emergency warning signs are trouble breathing, persistent pain or pressure in the chest, inability to arouse, bluish lips or face. Research suggested that up to 25% of those who become infected with the coronavirus may not show any symptoms but still can spread the virus. In that case, wearing a mask in public places is the only way to stop the transmission of the deadly virus. This is the map showing the COVID 19 outbreak scenario. More than 200 countries around the world have reported a total of about 3 million confirmed cases and of 230K total deaths. United States, Spain, Italy, France, and United Kingdom are now the top 5 countries struggling with the virus. This is the scenario of the USA. Experts say that numbers don't give the whole picture because many cases, including mild or asymptomatic infections, have not been diagnosed. The outbreak in this country, which now has the highest number of known cases in the world, is exceeds 1 million with a death toll of more than 60,000. New York has become the epicenter of the country's outbreak with near about 30,000 confirmed cases and 2,300 deaths so far. Massachusetts, Illinois are states have had high growth in reported cases and deaths. The good news is, in some states like New Jersey, Florida, Louisiana, Connecticut, the new number of cases are now decreasing. This is the breakdown of how the coronavirus affects people of different ages in the USA. Americans ages 65 and older are suffering the highest rates of death and serious illness from the coronavirus, according to a report from the CDC. Over 85 make up the largest portion of coronavirus cases, which is above 10% of death rate in the USA. Although older people are hardest hit, young people are not spared. Data from many countries clearly show that people under 50 make up a significant proportion of patients requiring hospitalization.
In this project, we wanted to model the COVID 19 virus outbreak and determine the maximum number of cases that would happen in our country. To do this, I began by downloading and cleaning the data and putting it into lists to be analyzed. Then I calculated the regression on the data for Chittenden County, for the state of Vermont, and for the country as a whole, and plotted the data and its regression. I also looked up some data on the spread of COVID 19 in England for comparison. In addition, I looked at performing some different kinds of regression on the data to try to get a better fit. The fourth degree polynomial regression seemed to fit best for the data in the US, as can be seen in this slide. In England, the third degree polynomial fit best, as can be seen here. As you can see in the graphs, there are multiple peaks of the number of new cases. This is probably due to a number of factors, including different states handling the situation differently, people going back to work too early, different places being at different stages of the outbreak, and the possibility of different strains emerging. We also looked at modeling the spread of the virus. We know that slowing the spread of the virus is key to reducing the number of cases and the number of deaths. I modified the code on the Epidemics on Networks website and used a Network X Barabasi-Albert graph to show a heterogeneous mean field approximation for the number of cases with different transmission rates. In this graph, you can see how the influence of the virus is contained by slowing its spread. I include a line to show how the capacity of the healthcare system limits the number of people that can be treated, and that slowing the spread enables more patients to get life-saving care.
I am interested in building a machine learning model to predict the peak of the outbreak based on the cumulative confirmed case. And I start with a polynomial model. And I found as the degrees increased, the curve fits the whole data set more well. But when the degree larger than 4, the curve start goes down, which doesn't make any sense because the y-axis is a cumulative confirmed case. There's no way to make that goes down. So I switched to a logistic model, and the logistic model has been widely used to describe the growth of a population, and an infection can be described as the growth of the population of a pathogen agent. So I think a logistic model seems like more reasonable than polynomial model in this case. And the the x in this formula is the time, like how many days, and a refers to the infection speed. B is a day with the maximum infections occurred. C is the total number of the infected people at the infection's end. And here I plot the logistic model based on the data from the CDC, and the blue dot is the measured data, and the purple line is the predicted data. And roughly, I think the peak is around at the day 120, and if you do the math, I think it's it's around May 20th. So um, here's what I found. Uh, since every day there's new data comes out, and you can always put that new data into your data set, but I don't try to plot every single updates. But here's what I found. uh, Based on the new data comes in every day, I always got different parameters value, the parameters of this logistic model. And although this model seems to be the most reasonable one for me, but the shape of the curve will probably change due to some unpredicted effects, like such as some government actions, like some states open the beach, open the restaurant, so that might be in fact the final shape of this curve.
Hi, I'm Joshua Powers, and I just wanted to show a little bit of the simple data analysis we can do with an interactive graph that we created. So here we have a graph where we can look at the COVID-19 data for all the different states, or for the US as a whole. We can shift the scale to be a log-log scale to get a better idea of its type of growth, whether it's exponential or not. And we can also fit a polynomial to it to get an idea of the manner of growth of the virus as well. We can also shift this to make it a degree 1 polynomial, which would just give us a linear fit and give us the average increase in slope, which can be useful on a log-log scale. Also interesting using this data is we can look at different states and see how they differ from the United States as a whole. So, for instance, we could look at some of these states and maybe see that their curves are very different, or we could even see that perhaps the way they count, they don't count every day. And so we can see something like Vermont, which seems to be leveling out, or even New York seems to be looking like it's about to start leveling out, versus maybe something like California or the US as a whole, which seem to be increasing, and just give a motivation for different policies taking place in different states and looking at possible reasons why the growth might be different, and why we should approach policy decisions differently in different states with COVID 19.
A report from IHME suggested that excess demand from COVID 19 at the peak of the pandemic in the month of April is predicted to be more than 64,000 total beds and more than 17,000 ICU beds. Ventilator use is predicted to be more than 19,000. Even by the most optimistic estimates, the demand for hospital beds, intensive care beds, and ventilators is expected to exceed supply as the number of COVID 19 cases increases. As the spread of COVID 19 continues, communities are being asked to reduce close contact between people. The goal of social distancing is to slow down the outbreak and flatten the curve. Flattening the curve is a term used to describe the slowing of the spread so that fewer people are sick at the same time. If many people are sick at once, this could easily overwhelm our hospital system, and we would not have enough beds for all the patients that need care. If the curve flattens, the outbreak lasts longer, but it also means fewer patients arrive at the hospital each day needing critical care. Slowing that pace down means there's a better chance hospitals can keep up with the demand by having adequate supplies, beds, and healthcare providers to care for these patients. As there is no vaccine to prevent coronavirus disease, the best way to prevent illness is to avoid being exposed to this deadly virus. When the situation poses a serious public health risk, we all need to do our part to slow down the spread of the virus. Last but not least, stay home, save lives. Thank you all to be connected with us.